right. I want to say welcome to Dr. Isuo.
Yes, sir.
Maurice Isuo, coming straight from Texas, from the Innate Touch Chiropractic. All right, Mansfield, Texas. What's going on?
Man, doing well. Blessed to be here. First time in Philly. So,
Serious thing. Glad to have you here. We're going to get right into it, right? And the question I have for you is, what do you think is the biggest misconception people have about chiropractic work?
okay, I would say, man, just ill-informed, man. Ill-informed is really what it is. The misconception, if I could just bundle it up, would be most likely that they think that it's just for, oh, I have a headache, or I have some type of, oh, I slept wrong. Can you just crack me up real quick and I'll be on my way? My low back is bothering me. Can you just give it a little crack and I'm good to go? I think that's the misconception, is that they view chiropractic in that way. And, society and, the administration, the medical models really push that for people to think that way about chiropractic. But truly, chiropractic is, for me, I believe it's the primary care for the human physiology. There's nothing that is more superior in a healing modality.
Explain.
So allopathically, if you look at the way that they approach the body, it's a outside-in approach, which means that, okay, you're having a headache. Let's go from the outside and try to put it inside your body to heal it. Let's give you this Advil, all right? You're having some type of gut issue. Okay, let's give you this nausea medicine, but wait, that nausea medicine needs this in order so you don't have headaches later. And then you be constipated. So they're giving you all these outside approaches to heal you inside, where the philosophy of human is first that we come from above. So that means that the source, God, whatever you believe, comes down into you. Inside your body, it operates, and then the last thing is it expresses out. So if you look at somebody's skin, if they have a lot of rashes or they have a lot of acne, that means that there's something going on with their gut, the inside. The last thing it shows is the outside. So the skin is actually showing the least damage of what's going on in your body. So you have a couple pimples, you just think, oh man, I got acne, but you got to understand that it's worse going inside the body, because the skin's the last, it's like this layers pushing out. And so, whenever you're dealing with chiropractic, we are adjusting so very close to the spine that it's the closest that you can get to the nerve impulse before you start jumping into the world of metaphysics, where they haven't really dove into or understand that. And now it's all woo-woo and magical, right? But just scientifically, they have shown a lot of research. One where the technique that I do is, it's called Hand Alchemy, right? And so this is a above, down, inside out approach. What we do is we analyze based off of the skull on spine relationship. So what that means is how your head is sitting on your neck, right? The first neck is called the Atlas. Atlas is what holds the world, right? If you look in Greek mythology, he's like holding the world, and the world is essentially your brain, is your world. That's how you process all information, and then how the body functions from that. So if you're looking at that and you're seeing that there's some type of tilt going on in the head, that you know that the rest of the body has to adapt to that tilt, because that's what's processing the information. So if it's tilting here, okay, well, guess what? We're going to have to make sure that your eyes are level with the horizon. So that means that we're going to slide the head forward. So then now it looks like it's a little bit easier, right? But then when that happens, the shoulders have to compensate and roll in too, because all of the front parts of the necks are pulling it forward, which is weakening everything in the back. Right, so they say it's like upper cross syndrome. Let's just put you in some physical therapy. Okay, I feel like every profession, massage, physical therapy, whatever, they have their niche, and their needs. I feel like everything is essential for whenever it's needed for that thing. But with chiropractic, it's such a powerful thing, because whenever you can change how the brain is processing the information, you can return and change what's going on in the whole body. Right. So that's the only profession where you can take that and shift that joint, right? Shift it, fix the positioning of where it's at, because just a micro tuning of the system creates such a dynamic change in the body. And so, for instance, whenever you are working with the spine, let's say that you are adjusting, someone's having like a little cough or some phlegm or some buildup. There's a segment in the spine, the thoracic, there's 12 segments. If you go to the fourth segment, that the nerves that run from that fourth segment stimulate the thyroid, right? The thyroid has ability to build these T helper cells that start going around the body, and they start to build these cells to attack certain like macrophages, monocytes. These are different things that attack bacteria and viruses in the body, or at least help. That's the goal. And so that's just one segment of what can happen. Or if someone, one research that we did was on the effect of frozen shoulders. So that's adhesive capsulitis. What that means is whenever somebody is trying to abduct, which means that they are trying to raise their arm from this lateral plane here, there's 180 degrees of motion in abduction. The first 120 is done by the deltoid muscle lifting it up. The other 60 is done by the scapula retracting and going down so that the rest of the arm can move up. Well, what they've noticed is that when people have these frozen shoulders, usually roughly around the ages of 30 to 55 years old, that these people, they think that it's a torn rotator cuff or some type of old injury. So what they do is they put them through physical therapy, right? Because that's also part of the allopathic bundle. You do the physical therapy, they get you on some pain pills if needed, right? And then if that doesn't work, then they're going in and they're going to do cortisone shots. They're going to inject it. And then you come back later, it wears off, it still is in discomfort. Then they do manipulation under anesthesia, which is like $12,000 a pop. And pretty much they just put you to sleep and just force your arm up. All right, you come back, arm still isn't working right. So then that's when they go and they do reconstructive surgery with exploration, which means that if they go in there and they cut you open and they find some other issue, you've signed the right for them to go in there and fix that without your consent either. So I think your bicep tendon's messed up too. We'll just do surgery on that as well. All right, so that's pretty much all they can do. That's the limitation of the allopathic model when your body is in disarray, or what I like to call it is in trauma. It's in a subluxation. Subluxation in the Greek word means sub means less than, lux means light. All right, so in that area, all that is missing is some type of chi, some type of input that's causing these symptomologies, that's causing your body dysfunction. That's my philosophy behind it. From the above down, we're light, we're energy is moving through us. We're just a structure, you know? So when these people have this frozen shoulder, what we realize is that it's actually a dysfunction in the occiput, which is to this day is the very specific, most important thing that you can adjust on somebody, because that's what's carrying the brain. And there's 12 cranial nerves that run from the brain that are very, very valuable to the body. One of them being the vagus nerve, which stems from vagabond. That means that they just walk around. It's a wanderer, right? So the vagus nerve is the same thing with your organs. It innervates every single organ in the body, literally. So what shares the same conduit or the same foramen, the same hole as that, the vagus nerve comes from the brain. It's a cranial nerve, and it goes down into the body, but it has to go through a hole because of the skull. It's all encapsulated in the bone. As that goes down, it shares the same conduit, another nerve goes down with it, the spinal accessory nerve, which is spinal nerve 11. Vagus nerve is spinal nerve 10. Okay, so the spinal accessory nerve innervates the SCM, which is, they say it's a neck flexor, but it doesn't touch any bone in the neck. So that's crazy. But really what it's made is to help modulate your head. You know, it's a primary rotator. So with your primal movements, if you are going to like grab something and bring it towards your face, the SCM is going to activate it to make sure that your head is able to turn and do that motion efficiently. That's pretty much the main thing, but also keeps your head level with the horizon.
There's a lot of chiropractic content circulating on social media, right? What's the key difference between authentic chiropractic care and the dramatic treatments often seen online?
Man, yeah, that is a good subject right there. So for me, I feel like that is, I'm calling out a lot of chiropractors on this right now, man, because I feel like primarily most chiropractors, 99% of the chiropractors are doing it for some type of like fame recognition. So they're posting content that's like memes and cracking spines, cracking bags of chips. Trying to create humor so then they can get their clients to come in, or they're emphasizing the cracks, like, oh my God, that was a loud crack. Just very like bullshit, man. It's bullshit. That's not true chiropractic. True chiropractic wasn't based off of that. True chiropractic didn't have this social media. It was people running around telling people, hey, you need to go over there to get healed. BJ Palmer was one of the developers of chiropractic. Not the creator, but the developer. He's the one that really pushed the movement of chiropractic. And in his prime, he was seeing about 1,000 people a day, and he was adjusting one segment, which is the atlas, which is very close to what I'm telling you. The brain, which is the most important thing. He wasn't adjusting everything else in the body. And he was getting these dramatic results. He was doing research on this kind of stuff. And the very first chiropractic clinic was in an insane asylum. Yeah. So that lets you know that these people weren't just adjusting people for, I have a low back pain. These people were fixing crazy issues, man. I'm talking about from the very first patient was deaf, right? So these people who with schizophrenia, like, this is what chiropractic was branched off of. People were going to jail for chiropractic back in the day, right? I'm talking about Herbert Reaver was the most jailed chiropractor. He went to jail over 69 times for doing chiropractic, not robbing people. He was adjusting people, and it was such, at that time, they were not wanting chiropractic to be this thing that it is, where it was helping these people heal, because it was stemming away from the capitalism that you can gain from doing an allopathic model. So they were jailing these people for saying that they can help with different conditions. So if someone was to go to jail, I mean, I'm an honorable dude, but I'm not going to jail for low back pain. I'm not doing that. I got my family, I got people I love. I'm not trying to go to jail for low back pain. So that tells you they're not going to jail from low back pain. They're doing serious healing, doing serious work. And so nowadays, people are doing adjustments that have like loud cracks. They're putting the microphones on. They're emphasizing the ASMR because they want to get all the views. They want to get all the notoriety. They want to get all the clout, right? And I mean, that's the generation we're in right now. But chiropractic's so sacred. It's the one thing that doesn't matter what religion you are, what race you are, what size. It's always going to work. It cuts through all those barriers because it's such a sacred work. You're just moving that spine and you're getting out of the way. BJ Palmer said if you're spending more than 1 minute with the patient, you're wasting their time. So people in there having to try to do all these different things to try to get somebody to feel better, when the main thing is you have to shift that joint and then you get out the way. Don't sit in there and try to put what you feel, oh, I wanted it to look cool. Let me do this adjustment because I know it's going to be loud. I know it's going to be, it's going to shock them. It's going to be this, it's going to be that. No, you have to do what's specific that's going on to the body based off of neurology. What's going on in their body? How's their body displaying that? And then whenever you go in and you palpate that, is it showing the same thing that you're seeing when you visually looked at it too? And then you run your exams and your tests to determine how the body is functioning based off of tone. And so how the profession is going right now, I'm very concerned. You know, I'm calling out all chiropractors to truly develop their knowledge and their information on what's going on in chiropractic. Not to, because I get it, you know, more than any other person, you want to make sure that you're making some type of financial gain in what you're doing, and you learn that these people that have all these followers, they have a lot of people come in, so you're going to just charge these prices. But if we don't get back to where sacred chiropractic is, we're going to lose people more than gain people, because now people are getting into chiropractic more than ever. The schools are growing. Whenever I was in there, my class was like 120 people. Now there's classes of 300, 400 people that are coming in to come and be chiropractors. I know that's strictly coming from how easy they're accepting them into it, but then also this YouTube and these funny videos is bringing these people in. But true chiropractic, from where its art and its work is done from, is you have to primarily focus in on what is going on in the position of the skull. That is the very most important thing, because if you adjust anything else, if you have some stomach ache and you just adjust something that's in the mid back and the legs, you might get some type of dopamine relief, right? Because there's going to be neurotransmitters that are sent to the brain that's going to be like, oh, okay, that felt kind of therapeutic. That felt good. So you'll be like, oh, thank you. but you're not gonna get a physiological change unless you have a dynamic shift into the occiput. And it has to be a certain speed too. So Heidi Havoc, she's a neurologist that does a lot of research for chiropractic. So grateful for the work that she's doing. Also, Dr. Michael Hall, which is another foundational piece in the neurological aspect of chiropractic. Very intelligent minds. And she did research to show that if you're not moving faster than 0.002 milliseconds whenever you're doing an adjustment, that you're not getting any physiological change. It's just like getting a massage. No matter if it's cracking, this, that, and the other, you're not getting an actual change in the system. And so when I was sharing with you about the frozen shoulder and the spinal accessory nerve, what goes on is that whenever they have that head tilt and their body's just been sitting in that position for such a long time, what happens is that spinal accessory nerve starts to get closed off in that foramen that it comes out of, that it's not fully sending the signals to the SCM and to the trap. Those are the two things that it innervates. So if it's not getting that information all the way to the trap, or it's limited, right? It's just sending small neural impulses to that area based off of what your brain is telling the body to do, it'll get stuck right here. So what we realize is that when you shift that occiput and you put it back into its right position, now it's sending all the information back that your arm can now do the retraction and put your arm all the way up. Same thing we notice with blood pressure is that whenever the vagus nerve determines how much acetylcholine is being dropped onto your heart, and that's what acetylcholine is, what slows down your heart from just beating rapidly like this. And so the vagus nerve, if it's having some type of occlusion or dysfunction, that it will slowly drop that acetylcholine instead of on a regular rate. And so now that the heart is pumping more, which is increasing the stroke volume, which is in return increasing the blood pressure. So whenever you stabilize the occiput and now you have it level with the horizon, we've noticed a dramatic change in people's blood pressure too. I mean, like, I take the blood pressure before, adjust them, and I take the blood pressure after, and it goes down 30, mmHgs in systolic. So this is, when I tell you, the most sacred thing that you can get to healing the body. It's like no joke at all. Like I said, I value all the other things. I know that massage has its place and physical therapy has its place, and occupational therapy has its place. These are all very important things, but when it comes down to root causes of things and how you can get down to the nitty-gritty of what's going on in someone's body, it's nothing like shifting that joint into the right position and then watching that send information back to the body and the brain, and those afferent and efferent signals start going back and forth, and now that body starts to develop. So there's this thing called like regulation, auto-regulation, how your body, it's not supposed to be always hot. It's not supposed to be always cold. It's not supposed to be always hypertonic or flexed and contracted. It's not supposed to be always relaxed. It's this dance somewhere in between, right? Where they call it, in most cases, homeostasis, right? Your body's ability to detox or whatever it may be. It's called balance. And the way that your body balances is based off of the functioning of your brain, period. There's nothing else to it. And so, when people are wondering why, whenever I have anxiety or I have depression, and they put these people on these pills, right? They put them on antidepressants, right? And I don't know about you, but any person that I met that's on antidepressants still depressed. So it's like, when do we get to the point where we're realizing that that's not what's working? And then whenever they get off of that stuff, because now they've been handicapped and conditioned with placebo that's stabilizing them, that they get worse. When are we going to realize that that's something that's going on in the brain chemistry? Because only the brain can dictate. So for instance, there's like left side and right side of the brain, which has different functions. So the left side of the brain is typically the one that lies to you, right? That's the one that tells you lies. Oh, you're not good enough. Oh, no, they don't like you, this and the other. The right side of the brain is the one that perceives joy, mostly, that helps you build relationships. That also dictates the creativity of an individual whenever they're more right side dominant. The left side is more sympathetic, fight or flight, more edgy, more got to get this done, can't sit still. Whenever you're eating, you're eating on the run. You're not able to like slowly chew your food and digest. Back in the day, dinner was a activity. You would sit down and you guys would talk over dinner. You would chew your food slowly, break it down because there's amylase that's in the gums of your teeth that actually help your food properly digest. So then you're not having irritable gut, leaky gut, things that are like shutting down your nervous system. The gut is it's a very important thing what your gut is because of the way that it's closely related to the brain. So if you're having a gut issue, like let's say one of the worst things I've seen people do is they take antibiotics, and and Jesus, bro, and they're giving it to the kids at such a young age. Oh, I got an ear infection. They're just flushing their body with these antibiotics, and the ear infection doesn't go away, of course. And then they just keep giving them rounds and rounds of antibiotics. Well, the antibiotics are destroying the gut flora in the top portioning of your small intestine. So it's just destroying that whole gut flora, which has important functions on how your brain perceives things. So they said that anybody who takes one round of antibiotics is usually 45% or more chances of having depression. Someone that has 2 rounds within a year is 77% or more chances of being depressed. So there's a direct correlation to like your mental health, which is one of the most things that's so important right now and that's going rampant. The suicide rates and everything is at an all-time high right now. It's so important, but the things that they're giving us and the things that they're saying is going to heal us is increasing these rates and people don't even know.
All right. Can you explain how the nerves in the spine are connected to the function and health of major organs in the body?
The main one was the cranial nerve. So let's say
Gut health.
okay, gut health. Okay, so for instance, the vagus nerve stimulates everything that's going on in your gut. So there's some people that have gastroparesis, which means that the mobility of how the food moves through their gut it has a form of like paralyzation. It's not moving the food. So then they usually have like high forms of nausea, bloating, constipation because the food's not moving through, breaking down. The duodenum and the duodenum aren't taking the nutrients and moving it through the body. It's just all staying loaded up in the gut. That's stimulated by the vagus nerve, right? That the vagus nerve is what makes everything move. So that's coming from, once again, the occiput. So if you can balance out the occiput, now all those functions that's going down to the body, it will help move that food along. Let's say someone who has drop foot. Drop foot is whenever there's an anterior tibialis muscle that runs down the front part, your shin area of your foot, and it creates dorsiflexion, which allows your foot to lift up along with the extensor digitorum in the foot. That's what helps the foot lift up. So whenever you're flexing your foot, that comes from that nerve that's running on the L4, the L5 that runs into the sacral pelvic bowl area. So whenever you adjust that sacrum, which is very important because it's sacrum because it's based off of sacred, because that's what reproduction comes from as well. I'm gonna get into that secondarily. So for drop foot, if you free that joint, free that foramen, like I told you, with a decompressive type of adjustment, wherever you're lifting the segment off of the one below it, now those functions of the foot come back, which I've seen on people from various ages. Secondly, with the sacrum, a lot of moms who are infertile, right, and they're having a tough time getting pregnant via different things. Most of it is coming from nutrition, but also primarily, even if they get proper nutrition, if their spine's not in a balanced state, then it's very challenging for them to also keep the baby based off of the blood not clotting is one of the big things. Some people they have MTHFR, which is an enzyme in the body that doesn't allow the blood to clot or coagulate properly. So whenever they are developing this baby, it's like bleeding out and they're having miscarriages a lot. And so with them, a lot of these moms are on folate. And so they are, no, not folate, folic acid. They're on folic acid, which is causing the baby that issue with MTHFR, that folic acid is just straight creating that same issue where they're having those miscarriages. So a lot of times when they're taking these prenatals, I make sure that they're not on that folic acid, and I actually give them true methylfolate or B12. And then that usually helps these moms have it, along with balancing out the occiput and the sacrum, because that's the pump of the cerebral spinal fluid.
Because I remember a doula told me she does recommend that women during their pregnancy go see a chiropractor. Yeah.
Absolutely. Yeah. So, whenever you're going through pregnancy, your body's going through all those changes, it actually changes into like a hyper lordotic state as the baby starts to grow, and especially in that third trimester is when they grow the most. That back starts to get into this hyperlordotic state, which is causing compression, like I was kind of telling you as well, on the L5, S1 area, which dictates the nerves that go into the legs. So most of them usually pick up sciatica. A lot of them have a lot of like pelvic discomfort, which we do techniques through Hand Alchemy, which is like a form of Webster, but where you release the round ligaments, you release the sacral tuberous ligament, and all these help get that pelvic bowl in such a position where most of our moms that come through and have our care, they do natural births. Most of them don't have like breaches or C-section, emergency C-sections. They usually just have such a perfect, because we get that pelvic bowl in such a position where they're not in pain, and they also their pelvic bowl is ready for that baby to just flow out. And so we get them there mentally too, as far as getting their mind in the right place before they get into something like that, because it's such a sacred thing to be able to bring a child into this this world. So
How significant is the role of stress when it comes to spinal issues and overall alignments?
stress is a huge thing. Whenever it comes to chiropractic, there's three main stressors that causes misalignments in the spine. This is a really good question, because once people understand this, they can understand why you should be going to the chiropractor for the rest of your life. That's one thing that I get a lot, is some people say, oh, once I start going to chiropractor, like, do I got to keep going to chiropractor? Or, oh, once I finish this, am I not done? Am I not good? No, because the stresses that go into your body, these are also known as traumas, right? These are stress causes trauma input that's stored into the body. The main three that we found that causes issues in the spine is going to be your thoughts, but people don't even realize that. But what you're thinking on a constant basis, right? So the human mind naturally thinks 90 thoughts a day. 80,000 of those thoughts you thought the day before that. And so if your thoughts are usually are influenced by your environment, so if your thoughts are depressive thoughts, right? Dark thoughts. You live in Seattle and it's raining all the time, right? You're upset at your kids a lot. You don't like your job. Cars having all these different thoughts start weighing on your mind, which causes the brain to have a slower processing as it's sending it down, which is causing these joints to start shifting, because based off of how the brain's sending information to the muscle's going to start micro-tuning the tone of the spine, which can pull on one side more than the other, which causes that joint to move out of its juxtaposition, right? So that's just from your thoughts. Your mental health is going to dictate if you have a misalignment or not, right? Or if you're going to get up off the couch, or you just go to binge watch a show all day because you're not in the good mood, right? You don't feel like being outside. You don't feel like doing this, okay? The next thing is toxins. So what you put into your body can cause misalignments in your body. So if you're eating a lot of processed foods, right? So or if you're drinking a lot of liquor, then that's gonna create an overwhelming feeling on your liver. So now your liver is gonna be like, man, I gotta detoxify all this liquor. But then wait, you're putting in this processed food, you're putting in all these sugars, right? That is killing you. And then also feeding the parasites that are in your body. So then now your liver is not only trying to detoxify the liquor that you put in there, but it's also trying to detoxify the processed foods. On top of that, you're eating foods with bad oils, canola oil, you're eating burgers, all this different stuff. So now your liver is just backed all the way up and it's stressed out, right? So now those toxins are building up in the body. And so your body just has to adapt. That's all it's trying to do. It's trying to keep you alive. And if they gave you the keys to your body, there's not one person in here that can make the hair push out of your head. You can't do that. You can't think and make your nail grow. You don't have that kind of intelligence. God is doing that innately through your body. And so that's the same thing as when you put all these toxins in your body's just overwhelmed. So it just starts asking the kidney, and it starts asking the gall. It's asking all these, hey, you start processing, we need help. And so it's adapting to the stress that you're putting into it, right? Through toxins. All right. And the last thing is through some type of traumatic, like physical situation, right? So if you get into a car accident, if you are a fighter, football player, anything where you're putting your body through some physical stress, that is also a trauma that can cause misalignments in your body. So you just got done running a marathon. Well, not every step you took was perfectly correlated with what you had going on. Not every strike that you did when you were doing your gait was perfectly placed, and your feet were your toes were perfectly spread apart at a good distance, and you get tired. You start getting tired, you get lazy. Now your body's just doing, and now it gets caught in that rhythm, and now it's a patterning physically on your body that starts storing your body as a stressor, as a trauma, and your body just adapts to that. Okay, you're starting to like use your right leg more dominantly, and so then it's going to start adapting and changing the structure of the hip, so then you can do this longer, right? And then it starts weakening and altering and pulling this side hip and weakening and contracting this psoas, so that now it can favor that motion that you're trying to do. But then when you get done, that body's still in that misalignment, and you just go to sleep in that. And then you wake up and you go to work and you're at the desk. And then you go, you want to run another thing, and then now you never really fix that issue. So then now it becomes a pattern in your body, and you're wondering, those people that have that walk and then they're walking, they have a little side step, and you're like, man, that's a little weird walk. They're like, oh man, I feel great. I feel normal. But that's just caused because of that physical stress stored in their body, and now it becomes some pattern until it starts to hurt. And and most people that come to my chiropractic office, 50 to 75% of them that come in there, they have no idea where the pain came from. I just woke up, doc, and I started feeling that. You know, it's like, what? Like, oh yeah, doc, I don't know. Like, I just woke up one day and my back just started hurting. It's like, there's no way, you know? Yes, that thing built up in there on those three main forms of stress and trauma.
Do you believe the popularity of extreme workouts online has contributed to more spinal problems in the general population?
Absolutely, yeah. People got to stay in their lane, man, know what the body can do. And so I'm not against movement. You know, I know movement is actually one of the key doctors in keeping your health and keeping you living for a long time. But yeah, whenever people start doing these crazy type of calisthenics, or their trainers have them doing some crazy type of movements, it's there's just a few movements that are very essential to the body. For me, one of them is you have to train the posterior chain, which means is you have to train the back, because that's what's going to hold your posture upright. And that's primarily through your extensors. Okay, so for the personal trainers out there, this is a pro tip for y'all to get good clients and for them to know that you're educating what you're doing. Stop training the flexors so much. It makes no sense at all. Because if you think about what the human body on a regular basis, first, they're always left brain, taking it back, the left brain governed. Most people are working on their left brain, which is their sympathetic, which is their fight or flight. Fight or flight is all of your flexors, because you have to be ready to either run, which requires all your flexors, or to fight, which is all your flexors, or to protect yourself. Fetal, that's all your flexors, right? And that's what people are in 90% of the time religiously, right? And then on top of that, whenever the jobs and the things that people do on a regular basis, it's all flexor dominated too. You hop in the car, you're sitting down in the car, everything's flexed, right? Legs flexed, hands flexed, neck flexed. You go into your job, sit on the computer 8 hours, hands flexed, legs flexed. You're in a seated position, right? So then what's crazy to me is that these personal trainers will get them into the gym and instantly start working their flexors. All right, let's get you on the bench press. Okay, so they're already in this flex position. They're already overly strong in these positions right here. It may not be like dumbbell weight strong, but their body balance is already too strong in this area. They have very, very weak posterior chain. And then you put them on these curls. All right, come on, curl. That's all flexor. Oh, you want to grow your glutes? Okay, let's get you on the hamstring curls. Now you're working your hamstring. That's a flexor, a major flexor. So then you tell me, what is the most injuries that people have in America? Bicep tendon, torn pec. Oh, I pulled my hammy. Oh, I popped my Achilles, right? You never heard someone say, oh, I tore my rhomboid, because that muscle isn't activated. It's very weak. So it's not a common thing that you're going to injure, because these personal trainers aren't strengthening the posterior chain, which dictates and governs the tone of your spine, which keeps your head balanced, which is giving you life. This is the anatomical position whenever you look into an anatomy book, because this is the most optimal position for your body to be in, for it to do all the functions properly. It's all an extension. And so we're so far away from the proper way that we need to be working out that it's like we need to do a whole class for the world right now, because most of these personal trainers, like you said, are doing extreme things that look good. I mean, social media is governing our life, man. That's the same reason why these chiropractors are doing these videos with like nice crack, and they're all focused on that. Same thing with the trainers, is like, how do I look different from just doing the typical you got it kind of train video? Oh, I'm gonna do an extreme different looking. All right, I'm gonna put a resistance band here. You gotta hold your arm up here. You gotta do, and they're doing all these crazy things, but none of it's actually important for the functional movements of the body.
What is your take on doctors who recommend epidural steroid injections, also known as ESIs, for patients with severe spinal pain?
I don't recommend it as the first thing at all. Okay, so whenever they're doing these epidurals, the doctors, their idea is essentially that if you fill it with this cortisone, right, and you input that into the body, that it's going to, which it does for the most part, calm that area down as far as you sensing the pain and the discomfort. It's not healing it at all. It's numbing it. So now you're not really feeling what's going on. The danger in that is that these people start to return back to their normal life because they don't have any education on what they did to cause that issue. And there's not actually a primary doctor, chiropractor, that is stabilizing that area, that pelvic bowl, that neck that they injected the shots in. There's nobody stabilizing that and bringing it back to order. So when you inject it in there, they're like, oh my gosh, that worked. So then they start going back to doing the same life they're doing, hunching over, lifting the same weights, and it's causing more pain on that thing because it never got fixed. And so now these people come back and they're in worse pain because it wears off.
And I never understood, right? If I need an adjustment, if I have a pinched nerve, right, and I take a shot and the pain is reduced, I still have a pinched nerve.
Yes, sir.
That's why I don't understand. That's the theory. Like, that's why I don't understand the theory in regards to that approach.
Yeah.
What if you have to adjust me to lift up the pinched nerve? Then
correct.
Maybe give it to me to reduce pain, but the pain would be gone because the nerve is no longer.
Yes, exactly. So that's the only way that it would have any benefit besides putting something for me. I say putting nothing foreign in the body. But if you were going to do those epidural shots, it has to be in conjunction with chiropractic care, because you won't feel that pain, so you'll feel good. But then you have somebody educating and reforming and balancing out your body, so whenever it does wear off, you stay out of pain. But if you don't, which is most of the time, if it's not through a chiropractic model that you're doing it in, and you're just out in the world, and let's say you do have low back pain, and you go to your primary care physician, and they say, okay, look, well, this is how it's going to typically go, which I kind of already shared with you, is they're going to be like, hey, look, we're going to put you on some naproxen, some things to relax your nerves, muscle relaxers. This is common, right? Okay. And then they're going to, after that, put you on physical therapy. Oh, we're going to stretch it, help you build your core a little bit, teach you a couple of exercises, right? But you still have that pinched nerve. Nobody's ever moved it off of that joint. Okay. And then after that, you still have this pain, this discomfort. Oh man, this looks like it's a little bit more serious than we thought. We have this minor procedure. We're going to put you to sleep a little bit. And we're going to inject this cortisone shot in there, or the epidural. And we know that this is going to help knock that pain away. All right. So then they go in there, they do that little minor procedure. First day, they usually get nauseous, have a slight headache after they get that injection, from what I've noticed with the patients. And then day 2 to day 3, they feel like Superman. Oh man, doc, I don't feel nothing at all. That's exactly what I needed. Right. Right. Yes, sir. That pain creeps back. And then now when you go back to the doctor and you say, hey, doc, this actually got worse. They said, okay, look, this is more serious than what we thought. What we're going to need to do now is we're going to have to go in there and we're going to do a surgery. We're going to either cut that nerve, laminectomy, fusion,
I
disectomy.
have this right because I know doctors get a bad rap in these modern times. Is this done out of uh, greed or is this done out of incompetence?
Okay. So,
And I know we can't generalize, but
exactly.
in my experience, like I'm not a doctor, but I'm a knowledgeable person. I'm knowledgeable about my body. And sometimes they say stuff, and I just take it as maybe they're too busy, or maybe you just don't know what you're doing.
Mm-hmm. Yeah.
Because what you're telling me I need is not what my body's asking for.
Yes, sir. So, on that note, like you said, you never really know what kind of doctor you're dealing with. But I'm just gonna say that they signed an oath, so they said do no harm. So the ideology is that they're doing the very best that they think that the body needs. But whenever we really dive into it, it's all based off of character. Who is that practitioner that's doing it? So this practitioner could not have he possibly wasn't the most brightest person in that class, right? Anybody could have he could have been the person that might have not really studied that much or really delved deep into the body. So it might be a form of incompetence where he's like, hey, I really don't know exactly what you got going on. But in the general idea of that area, this is my protocol that I follow. So I'm just going to put you in that box.
And I'm glad you brought that up because there is there is a distrust of doctors for historical reasons, especially amongst black people, right? But at the same token, there is an idea that the doctor is well educated and a brilliant person, and that's just not the case. No disrespect, bro. But I think like once people have this medical doctor thing, like people have this perception of them, and when you talk to them, even outside, just in general, they're not the brightest people. Not, I'm not generalizing all, but I'm saying there are many that fit that category. So I think that's one of the reasons some of the care, along with the pressure of seeing so many patients, leads to decisions that they make that aren't that beneficial to the patient that they're supposed to.
Misdiagnosis. Yes, sir. Yeah, that's one of the main things that that happens whenever people get hurt or they get worse under the allopathic model is because it's misdiagnosis. A dude comes in and says he has gut issues. All right, well, like you said, they have many patients coming in. They're just like, oh, okay, gut issues, gut, probably irritable bowel. Okay, let's just say it's irritable bowel syndrome,
Facts.
right? But
No action.
yeah,
Nothing.
nothing, because they don't have time. They have the PA is the one who actually did all your intake, so they just come in real quick and they just look, okay, gut issue. Hey, how's it going? Okay, I see you have gut issue. What we're gonna do is we're gonna put you on these sets of pills real quick, and then we're gonna check up on you in 2 weeks. Okay, you have a good day. Well, then what happens? They never even went and touched your gut. This is why I'm telling you that it's so important that you go to a chiropractor as your primary care physician, because that's the first thing we're gonna do. Well, you have what? Let me see. Where's it at? They're gonna feel it. What's it?
I respect the Dr. Galgano out there because I always tell people, you know, I spend the most time with this man. I feel this man talks to me more than my primary care physician
Yes.
in regards to asking me what's going on in my life.
Mm-hmm.
The chiropractor, more than my
Exactly.
primary care physician.
Exactly.
Spends time and actually asks you everything so he understands what has been going on. How you feel?
Yeah. Absolutely, man. And that's why it's such a and why I'm grateful, you know, to be honest. And shout out to Erica too for connecting us.
Yeah, respect.
Shout out to Erica for connecting us. But why you know, grateful to be here to be talking about, you know, the power of chiropractic, because kind of going back to what your subject is, there's just a misconception, and there's a level of ignorance around it because of, and it's not all their faults. I mean, the society kind of makes it that way, where it's like,
Even in comedy shows, I was talking to a brother. He was talking about Afrophobia in comedy shows, and you know, the brother that's conscious, he got the bean pie. He's super militant.
Yeah.
Like, they make a joke out of it. But scenes that I reflect on in chiropractic has never been presented in a good light. It's always like,
yes,
extreme thing, and we never got into like the actual healing aspect. It's like, it cracked my back, and like, you know. So I think Hollywood has also played a role of the stigma on chiropractors.
yes, absolutely, man. And that's why I told you that I'm challenging all chiropractors to inform themselves on the philosophy, because chiropractic is based off of the philosophy, the science, and the art. And right now, many people are caught up in the art, and they are just running away with that. Like, okay, this adjustment looks cool. This adjustment gets a lot of views on YouTube based off of other chiropractors. This adjustment has more of a comedic relief to it, and it's Hollywood, right? But then they detached from the science. So what shocks me is that many chiropractors, they just crack the same spots every time. That's what they know works. Like I told you, that adjustment was loud. They got a lot of views. They don't really know the science behind what they're doing. And yeah, they run the exams. Hopefully they all run the right exams to see what's going on in the body. But that doesn't mean necessarily it doesn't stop there. There's other layers to it, right? And so they don't really even know the neurology. So I got my master's in neuroscience. So I dove deeply into the neurology of how this information is getting sent into the body. So all these different things, you have to trace it back to what is the main thing that's giving information efferently to that knee joint. It's coming from the brain. So that's the science of how the body works, how tone is dictated, what these certain tests are actually testing for. Like if you're testing on babies, you can dictate on a baby what kind of issues it's gonna have in the future based off of the tone of the spine. So if you carry the baby and you just hold the baby in the on its belly right here, and the head's just drooping like this, what happens is about to 2 months, years old, the baby's head's supposed to at least try to lift. Right? That means that the tone of the occiput and what's going on to the spine is activating. If they starting to have that droop and they're not even able to activate it, then that's early signs of autism, right? If these kids, it's called like a pacify test. If you take a baby and you just bounce around like this, the baby's supposed to naturally pacify itself. If the baby stays all rampant, that means that it's having a issue with its tone of its spine and its regulating system. So then you can see that that's early signs of autism, dyslexia, different things like that too as well. And there's multiple tests that you can do for this to dictate on the kids that what's going on. And so this is something that the medical model or they're not looking at the body that way, but they're the golden standard for medical education and medical superiority. Is, if they're a medical doctor, it's the end all be all, that's the truth. And like I told you, they have such a high malpractice policy that they can just say, you got irritable bowel syndrome. And if you come back later on saying, hey, you actually ruined my life, I talk to my malpractice. Next, you got irritable bowel syndrome.
That's great.
So
next, in preparation for the interview, we spoke on the phone, right? And we spoke about the use of marijuana and the quality of modern marijuana. You discussed the intention, the importance of the intention of using the marijuana versus recreation. In your opinion, right, what should people consider or do before using herb in order to experience its full benefits?
It's a plant medicine, it's made to be truly medicinal. Most medicines now that are like digested into the body or absorbed into the body is, like we know, pills and these different injections and trinkets. Well, what we came from originally is that we would get these herbs, we would figure out the quality of these herbs, not only like marijuana and leafy things like that, and oregano and mushrooms and all these different things that grow from the ground, they grow from the earth. These were all tested by our ancestors before us, and that's how they realized these effects, and they were able to use it to heal, right? So they'll be like, when I take this marijuana properly into my body, I'm able to help pass bowel. I'm able to calm down my nervous system, so then I can be able to make a more accurate decision or whatever it may be, right? And so back in the day, they weren't having these certain things that modern day, whenever you're using marijuana and you're just rolling it up in a swisher, or you're rolling up in these different things that are highly, highly chemical, right? There's no natural things that people are using it with these days. It doesn't have the same effects medicinally. It's now diluted the potency of it by almost 90%. So now you're just getting most of the paranoia, really, And so there's actually a sacred way to be using this. So when the tradition of it would be passed down by actually ancestrally. So the best way they say to use the medicine was through a pipe, or like the old pipes that they use that they smoke tobacco from, and that would get passed down from your father, and it would be in a ceremonial fashion. So that means that you would first set an intention, and then you would get the dose, pray over that dose with the intention that you have for it. You would smoke it with that limitation, and then you would sit with it. You would sit with it and feel the process that are going into the body and watch how it heals. So then now you have built a relationship with that medicine. It's not just you just taking it, it's like whatever, let's go party. It's like you have sit with that medicine so you can see what is it doing to my body, and when it starts going out of your body and starts detoxifying out of your body as well too. So that's the medicinal way that it's supposed to be used, but it's not used like that, quite frankly, at all. It's just, used to just smoke, so.
Speak about the paranoia, because I'm an old head, so I'm out there, but I do hear a lot of brothers speaking about how this modern herb is, and I thought herbs supposed to cool you off, but they speak about the paranoia right now. So why are people smoking it so much to give them paranoia?
So with the paranoia, that mostly comes from like the brain chemistry. So usually some people, whenever they are they're usually in social settings and they're using it as some type of like coping mechanism. So they already have issues going on. They already have they're running away from something in their life. They don't have much stability in their mental health already, and so then they're just overindulging in it. And so what happens whenever you overindulge, and now that is so deeply rooted to your bloodstream, and it starts getting to the brain, it starts working on the brain. Now the brain, the part of the brain where the frontal cortex is, so there's different lobes. There's the frontal cortex, the temporal lobes, and then you have the occipital lobe. Whenever that frontal cortex starts to get inhibited, now those things like paranoia and things can start encroaching, or anxiety can start encroaching on you, or someone feels almost like depressed, don't feel like eating, whenever after they got done smoking. All those.
I used to burn herb to help with my anxiety.
Yeah.
It's kind of wild for me to smoke herb and get anxiety
and get anxious. Yeah. And so
scary, actually.
yeah, man, honestly, and that happens to some people too. Is like when you and this is the overindulgence and not the proper use of using it. While you're overindulging, you actually get negative effects.
I heard you speak about initially just talking about the proper dosage and the proper amount, and just sitting with that.
Yeah, absolutely.
Yeah.
And that's all that's all dictated to based off of your tolerances. Some people try to like just blow their tolerances out of the water, and you're supposed to you can just take like a certain amount, or like a pinch, microdosing actually, and just for it to stimulate into the body and create that first relief of, and that's where you're supposed to settle there and sit with.
Supposed to go highway up.
Yeah. Come back later, munchies out, and just like wondering where you been, where's everybody at, and so that's my intake on that. But there's multiple different plant medicines where I feel are beneficial for the body, and
some other plant medicines you feel are beneficial.
Okay, so there's some like one that I utilize a lot it's actually animal medicine. It's called Cambo, and it's a frog medicine, and it's from the Amazon. And what they do is they take this frog that usually lives high up in the trees, bring it down.
That's not the ayawaska, is it?
No. So ayawaska is very beneficial too. That's another one that's a vine.
What's the other one? MG something?
MG. DMT?
DMT.
Okay.
DMT or no?
No, so ayahuasca has properties of DMT in it, but it's all more natural. That's what's in the actual vine and in the leaves. So they use leaves and the ayahuasca vine, mix them together, and in these leaves is DMT, and then in the ayahuasca vine is that the bonding element of it. So now whenever you put them together, you have this like 4 to 6 hour ceremonial experiences where your body is not only like eliminating things from your body, like as far as like bowel movement wise, you're getting out of your body, but also any like toxins and stuff are being stripped out of your gut lining and getting moved out.
Go back to the herb you were recommended and explain.
The Cambo?
Yeah.
Okay, so Cambo is it's a frog medicine. So they usually rest higher in the tree. So it's actually the higher in the tree they are, the more potent the medicine is, because they're not touched much. So what they do is these frogs, they claim that they're poisonous, but really they just have a defense mechanism that if some intruder tries to attack them, they secrete this poison that usually makes that animal back off. Like, yo, I don't know, like the way I feel, it's instant. And so what they realize, the Native Americans, when they're working with these, I mean, they are nature, and I know you interview a lot of Jamaicans, and that's the number one thing is that, nature is like everything. And you want to go back to nature in order to realize who you are is from nature. And so they would, take this frog and they would irritate it, let the secretion come out, and they would scrape it off. And then they would take it in at small dosages, they would input into their lymphatic system. And so then they can get this secretion in there, and then it actually has not only stimulating detoxification in the body, but it also adds in poly and neuropeptides, which is really important for reconstructing new DNA and new behaviors in the body. And so this is something that, when used properly, you can get rid of many conditions. If you have like Candida infection in your gut, parasites, you take rounds of Cambo, you can get rid of parasites. Same thing with whenever you're doing ayawaska. But another powerful thing about ayawaska, with it having that DMT property, is you got. Also, let me preface, with all these different medicines, if you're getting into this, you need to make sure that you're sitting with a proper practitioner to guide you through this. This is not something you just buy online from the black market and you just take it home by yourself, because that's dangerous. That's the reason why if it gets any bad rep, it's because of that.
Can you tell us about your experience with ayahuasca?
I went out into, I actually have done it out in the jungle where I went to Peru, and I spent some time up there with the elders, and they are very sacred with the way that they do things. It's been passed on from generations. So this is something that's like 5, 6 generations they've been doing this medicine. And so they have a whole sanctuary where you come in there and you have to get rid of all of your American, or if you're Italian or whatever, all the worldly things that you invest into and you believe, all those different things, you get stripped from all that. So when you first get there, they make you take a oha sache bath, which is they clean out all of the toxins that are from America from using your laundry detergents, colognes, deodorants, because all those have chemicals in it. I mean, all you gotta do is just read it back and see all the aluminum and stuff that's destroying your body. So they do that first and then cleanse you, so then you can be accepted by the jungle, because everything is all energy. So if the jungle is if the frequency of the jungle isn't accepting you into it, then it's going to try to get rid of you. That's just, I mean, it's just sad, the truth of what it is. And so they first cleanse you from all that, so then you can be familiar, you can be comfortable within the jungle. And then you have to go on a fast. So during this time, you're not eating any sugars, no salts, anything that is contaminating to the body and the brain chemistry, they eliminate it from you. So everything is at its natural form. If you're eating a plantain, you're eating a plantain raw, no salt, no seasoning. You're eating the plantain raw, its rawest form, because it's easiest for the body to digest that way. And it gets rid of all the other junk that's in your thing. So then it all passes through, and then your body's a clear vessel.
How long is the fasting?
Every day. Yeah, so it's not, I wouldn't say necessarily a fast from food. It's a fast from typically what you would be eating. Yeah, so before you actually take the medicine, it's about 6 hours that you're not eating at all. But in that morning, you can eat, they typically say stay away from mango because it's really high in sugar. So they try to say don't eat too much of that. But they have passion fruits, apples. They make you little rice, little potato, cloves. Really big on cloves. But everything they get in the jungle, and then there's no phone. You know, there's no electricity, there's no AC. You're in the humidity of the jungle, so then your body is just constantly sweating and pushing out things as well. So this is it's ayahuasca is like one section of it. The jungle itself is the medicine itself too, because you just being out there in the jungle in your natural state, it's challenging. If you're used to the United States,
Explain why you say it's challenging.
if you're used to just being inside your room and being able to flick on the AC from your phone, you know, you can like literally do whatever you want from a touch of and then you go into here and you can't do any of that. It's like a shock to your nervous system almost. You're like, wait, I can't, okay, phone's gone. Okay, wait, what do I do next? Okay, can't even. So when it starts going to nightfall, you have to use candles, you know, and when the candle is done, it's done. So it's dark, you know, so you're sitting there, you can hear the noises of the jungle. You hear things out there. You hear little growls. You hear, you know, ruffling around leaves. You're just like, what is outside of where I'm living right now, you know? And so there's times where I had flashlights and, you know, of course, things like that. I had a mosquito net to protect me from all the mosquitoes where I was sleeping at. And there's no AC, so I mean, you're sweating through your sheet every night, man. And so that's new to me too, because I'm usually, I'm very warm-blooded, man. As soon as it gets a little warm, I'm sweating, you know? So, like, not being able to just quickly regulate that with AC or something is challenging to fall asleep to that, you know? And there's just times that out here ruffling and I'll shine the light and it would be like a big wood rat eating my tambo, which is basically like 4 wooden panels and then a whole bunch of dead leaves on top. So it's not like you're like anything coming there really. If it came down to it, it's the perception of being all right, you know? And or times that you're shining a light and you see a tarantula, you're like, oh, what the heck? I don't even see that regularly at home, you know? Or the cockroaches are twice the size and they hiss, they make sounds, you know? And in the jungle, you're not allowed to kill anything. So you can't, they say that's like a no-no because you don't want to harm the jungle, you want to unify with it. So that's also a challenge because in states you're like, oh, yeah, you know, like all of it's just it's an adversity to try to adapt to something that you're not very used to. And you just get, like me, I'm the kind of person, I just jump into the unknown. There's no warm up, you know, I'm not like, I just go in there. And so that was a challenge for me. But whenever you're sitting with the medicine, you do that in the night and it's a ceremonial process. You sit with the elder of the village. He's like 60, 70 years old. His father's been doing it for a long time. So it's very, very important. And everything they do is very important to them. They take it very, very seriously. You sit right there. I sit right here. You drink from this specific cup. Like everything is very like structured because there's intention behind everything that they're doing. And they cleanse you, you know, they make sure that there's no evil intentions or nefarious things trying to mess with you. Yeah. And that's why it's very important who you sit with, because some people, they have no education on it. They're just like the people that think that they can just crack necks on there and get YouTube views. There's people that are like, oh, this is a cool little fad. Let me try to make money from this. I'm gonna charge $2,000 and say you can do ayahuasca with me. But they have no idea what they're dealing with. It's a very important thing. And so whenever you're sitting in this medicine, it's an inside approach to your body and how it is expressed out. So a lot of people say that they are looking for like a spiritual healing, right? Well, there's no such thing as a spiritual healing because the spirit's already whole. God didn't make any mistakes when he made the spirit. The spirit doesn't need friends. The spirit doesn't need all these different foods and all that stuff. The spirit's already there. What people need to do is they need to heal the bad behaviors that is surrounded around the spirit that's causing you to not be able to fully express it. So whenever you're sitting in this medicine, you're looking at your behaviors. And so
real quick, how would you describe the taste?
It's not tasty. Yeah, it tastes very like gritty.
Sludgy, is it?
Yeah.
Right.
Yeah, sludge.
You drink it, right? And I take it you start to see your true self.
Yes.
How dark is that when you get to see your true self?
It's varies for everybody, but for me it was like it was almost kind of icky, you know. It's like all the things that I thought have slowly became my identity of who I was, but not who I truly was, because who I truly was, it was beautiful, but what I was creating this manufactured identity, that thing was disgusting. That's not really who I am. So when I went down, saw my true self, whenever I'm doing this medicine, it was a blessing. It was like, oh my gosh, like there's so much light, there's so much love. But then I was seeing what I was showing to the world because I'm trying to fit into a certain description. I don't want to be disliked. I don't want to have this or that. I like this material things that created an image of me that was almost like, nah. And so what you do is you just shed those things that are your identity, and it's a hard process because you've attached to that. Who you think you are and you created in the last 28 years, you've attached to that. So whenever you're singing the mess and you see who your true self is, and it's like it doesn't need any of those things, and you're like, wait, I gotta get rid of like those friends. I gotta get rid of those items, those relations. Like I have to. No, I like those. Yeah. But it's not you that likes those. It's that identity that likes those. Yeah. It likes to be liked. You know, it likes to be favored. It likes to think like you're awesome. Those people think you're awesome. You know, but those people are only feeding that identity. You know, and so whenever you're sitting with that, it's very challenging because it takes time. You know, you have to show yourself grace because we're only human, and human psychology likes to be liked. You know, and so to be able to, not saying you won't be liked if you do it, but most of the things that you want people to like you for is nonsense.
What else did you see or experience during that experience?
I saw quite a few ancestral things, you know. So my father's father dove a little deeper into the past, seeing why I am the way I am, because so essentially we are unfinished business of what our parents didn't get to finish. So if my dad wasn't able to get rid of lust or something, then that's something that's got passed on to me. I have to figure it out now. And my father before that, right? And his father, it's whatever the unfinished business is, it just gets passed on to you. So I was able to go back and to see where all that stemmed from. I'm from a Nigerian culture. And so I was able to, which was cool, is in one of the ceremonies I went back and I sat with my grandfather as he was doing a meeting. My grandfather was a chief of his village. And so he made all the decisions for the people, and all the counseling for the people. So marriage advice, anything that you need, they would just come and they'll go talk to him. So he was a very, very powerful dude. Also had like over 100 kids, 20 something wives, you know. And so, and back then that was the determination of power, is how many kids and everything you had. So I had time to sit in that one of the meetings, and I was able to see, more so it's not like I'm sitting there having a conversation with him like this. It's the energy and the presence of what you're feeling that is information that your body can process into what was going on during that time. So me sitting there and being in the area, I could sit and look and identify and watch what was going on in those meetings, why they favored him, how he felt when they would say certain things. I was getting that information too because he is me, and you know. And so sitting with that ancestral information was very pivotal in my healing process for me to be able to pass on this healing to other people, because in chiropractic, why I say it's so sacred is the best practitioner isn't really the one that gets the loudest cracks. It's the one that is able to have healed so much that they can now take you to somewhere that you haven't been, because they've moved past that healing. They've healed that within themselves, so they can be a sacred mirror, so that you can look and be like, okay, I am dealing with that kind of issue, and that you can get vulnerable enough to let that healing flow through. And so that's my goal, is that I have to clean up all these behaviors, all these things that I could be attached to, or I think that is important, and fight off the clown show. None of the stuff that matters. This stuff doesn't matter. This physical, this is 99% of what the world is made up of is energy, you know. And they looked into, physiologists actually looked into this, and they looked into an atom, and they saw that, you know, 99% of that atom is just space, just energy, potential energy. And 1% is actually the neutron, the electron, the proton. So that means that this right here, that's a physical thing, is only 1% of what's really going on in the world. But we're so attached to the material thing, which shows that we're so far off the mark. So our identity is so far off the mark that, of course, we're having all these issues where nobody can get along, and it's this versus that, Republican versus Democrat, divide and conquer. Of course, that's going on in the body, because the whole mindset is so damaged where their behaviors is only to justify their identity. That's the reason why people go to war. That's the same reason why they shooting people on the block. It's because their identity is like, no, I gotta look like this for that person. I gotta have that. I gotta be good, you know? But the true spirit doesn't need any of that. It never did. It didn't need a friendship. It just needs, you know, food, water, and a place to grow. You know, so whenever you take it down to the simple things, nature, you know, when you talk to the Rastafaris, man, they go back to nature. They're not really looking to be pleased and all these different things. They're just looking to make sure that they're letting the spirit be expressed, because then that's the closest thing that you can get to whenever you go back home or you want to go to heaven or whatever your perception is. The closest thing you can get to is deleting all those behaviors so that you can be more connected to the spirit.
We spoke about earlier in regards to the power of the mind, right? I can attest. So I have this tension area that comes and goes. I actually say, I would argue that I control it based on what I'm doing, my stress level and my fatigue. Based on my thought pattern, I know what's coming in. And based on my thought pattern, it cools off.
So that, like, based off of the 3 T's that I told you, the thoughts, the trauma, the toxins. Yeah, so your thoughts, you can literally just...
I can literally say, like, if I'm really stressing and bugging up top, it flares up.
Yeah.
Then I could catch myself and change my thought pattern, and it'll cool off.
Yeah. See, and that's man, that's a blessing that you're able to see, you know what I mean? That's a blessing that you have the awareness, because that's all we're really doing whenever we're lying in this body, is we're increasing your awareness, your ability to be aware of what's going on in the body. Because to most people, their awareness is very low. So they're just like, I just don't know how I'm hurting. I can tell you right now, anything that hurts my body, I can tell you why it's hurting. You shouldn't be that disconnected from your body where you're like, I don't know why my body's hurting. But most people are, because of the overstimulation, being left brain dominant. They're constantly being go. They never sit down and they rest. And like you said, you sat down and you can be like, oh man, I'm stressing. And then you can, the stress, and then it goes away. Awareness, you know, and that's just one fragment of what it is. There's ultimate awareness too, where you can like sit in one space and you can notice what's going on outside the room, because you're bringing your awareness more than just this space right here. You're expanding your awareness. And that's one thing I also learned whenever I was in the jungle, is that they said that thoughts are very dangerous because thoughts contaminate the mind. Just like, you know, when you're stressing, those thoughts contaminate your body.
Facts.
You know, it's the same thing, that those thoughts can contaminate not only your mind, but if you want to be, like for me, for instance, I told them, you know, when I went down to the jungle, they all speak Spanish. And I told them that I'm a chiropractor and that I work with my hands, and, you know, they're aware of what I do. And so they said, okay, well, you're essentially, in their village, you're a healer. So they had me get to work. You know what I mean? It wasn't like I was a luxury person, even though I was paying them to be there and to sit with these elders for this time period, this 2-3 weeks. They treated me like I was a person in that village. So they said, okay, you got to go to work. So I was working and creating the medicine, right? So I was breaking up the vine to get the meat of the vine, because you can't just like grab a vine and just make it. You have to like break it open, you know, get all the meat in, then you get all the leaves, and then you boil it for hours and hours, and then strip out all the waste, and then boil it again and keep boiling it until it's the sap that, you know, I was telling you. And I was working on it, and I have a video of me doing it. And I was just working on this vine, and I was just hitting it. And I was just hitting the vine because they use a mallet, you know, wooden mallet, and they just crack it open, and then you start getting the meat out of it. And he was like, yo. And I was like, what, you know, what's the issue? And I'm just crying. He's like, no, you're here. He said, you need to get out of your thoughts and just focus on the medicine. And I was like, bro, I don't feel like I'm even doing anything. But yes, by the way I'm striking it, that I'm in my thoughts. And quite frankly, I was, you know, like just micro thoughts. It wasn't even like I was just like, man, why am I? It was just like, just thoughts of, okay, I'm in the jungle, you know, just thinking. And he said that that's contaminating the medicine. So it's going to have an effect that when I'm done making that medicine, they drink it, it's going to be no good. And I was just like, so then he broke down to me. He's like, look, he's like, even if you're making this medicine, you just go up and you look at somebody, just look at a friend, and you look back at the medicine, you have contaminated your whole work, because it's all based off of intention, you know? And so then that like gave me goosebumps and chills, because that was, I think, one of the greatest lessons I learned whenever I was out there in the jungle. But ancestral, all that doesn't matter. That was the greatest thing I learned, was that not letting my thoughts contaminate my medicine. So if I'm working on somebody and I'm making sure that I'm focused in on that adjustment I'm working, I can't be before that listening to King Von and I'm contaminating my medicine. I can't be going over there and eating refined sugars and, eating Chick-fil-A and all this processed food and then coming to go adjust somebody. I'm contaminating my medicine. Everything is so detailed on, what you're doing before you're committing and doing that work. And so, I mean, it's not something I recommend for everybody because I know now, like when I was younger, I was just like, everybody should be doing whatever, but it's not made for everybody to be broken up in that way. Most people aren't ready. I think that most people should, if they have the means and they have the awareness, because it's survival of the fittest, at the end of the day, not all people were made to survive or be on that level where they can like really get deep and break down things so they can be a certain pillar in the community. Some people just made to just go to work, do the thing, go back home. You know what I mean? And so I know that my path is a little bit different, not saying it's a right or wrong path. Mine's just a little bit different. For people who are very similar to what I'm doing or strive for that, I advise and challenge to work on that internal work. It doesn't have to be ayahuasca. It doesn't have to be any of those plant medicines. But you got to find some time where you're sitting silently, because what's the issue with today in society is that there's a lack of true love in people and how they communicate because they don't really truly love themselves. A lot of people, if you challenge them like, hey, I want you to go home and just sit in silence for 30 minutes by yourself. They can't do that. They're fidgeting. 5 minutes in, they're like, what was I supposed to eat? Or I need to text that person back. Or that's in that email. They can't. 30 minutes to just sitting there silently and sitting with yourself. Because if you're sitting with yourself, do you feel like you're sitting with a complete stranger? They don't know who they're sitting with. So they feel uncomfortable. They feel almost fidgety.
Dr. K. Adamawi Knife said the person you spend the most time with, you know the least about.
Yeah. Literally. And it's crazy, man. There's so many different like tools that kind of show where people are lacking in that aspect of, what's actually going on the inside and how to like heal and purify that thing so you can be a proper vessel in the community.
All right. So from what I understand, you travel to numerous countries, right, to do work and assist with numerous programs. How has that exposure, being in different countries, changed your perspective on life, the world, especially countries that just experienced some form of natural disaster?
Gratitude, just straight up gratitude. And I thank God for creating my life and putting me in a profession where I can see that in real life, in real time. And so I was young. I was like 23 when I first went to Haiti. And, it was right after they had a hurricane I believe it was a hurricane at that, or some type of tropical storm that just like flooded the whole area. And so I remember coming from America, it's like since I'm a Nigerian, first generation Nigerian, my parents, my growing style, like the way that they developed me in that time, I wasn't super pretentious and thought like it was, they were just getting in, they were very like, shh, don't do, follow the rules, so it was very shrinking personality, very like, so I was never really, I learned a lot about not having much. So, but I was also born in America where they did all the hard work and now they were just providing things for me, and taking care of me essentially. So to go back and to see similar to how they grew up, seeing them in these, mud huts and they're not playing, like they're playing soccer with bottle caps, just it. And then to see that they were actually more happy than people in the States blew my mind. It was such a shift. It's like, wait, these people don't have much at all, but they have more of a community where some lady can walk out and discipline a kid and it's normal. But if you touch somebody else's kid right there, it's like 10 years, lawsuit, a whole mess, right, in the States. So the shift of community where this place is supposed to be like, oh, you know, let's whatever. And in perspective, you know, there's things that, of course, but the actual demeanor and the energy of what's going on in that place is light years ahead of what's going on in the States.
So why do you think misery is so high in America? Because I remember, man, like, not Jamaica per se, but when I went to Ghana and came back, I really felt it. Where it's just like I was at JFK and I just felt the energy, right? And I was looking at people's faces. And I said, "It's not where it's at." Like, people were so miserable, you know. And as you said, you're in another country. You have the rich, you have the poor, but it was alive there, and there was a spark in that that Americans don't have.
Mm-hmm.
So why do you think that's the case? As someone who's traveled so.
That Americans are more miserable.
Yeah, they don't have that spark in there collectively. Not all.
Because it's a perception of freedom. Yeah, it's a perception that you're better, like that you're in the best place, but really, overall, you're still stuck in this box that you never really can branch too much out of because your mindset and everything is keeping you in that same box. So I feel like most Americans, they have, because I'm in America, they have a level of entitlement to certain things too. They have more attachment to things too. Like, okay, because I'm an American and I have this car, they're gonna do everything for that car. So, and I have this house, an apartment I'm paying for, they do everything for that apartment. But when you think about it, that work from 8 to 6 o'clock anyway, so most of the time the house is vacant. And then they only drive the car to and from work, so most of that's vacant.
It's a weird system when you think about it, bro. That sacrifice, what we do, is a weird system. And like, I know that's why they keep people busy so you don't think about it. But when we really break down what we're doing, one has to argue it's foolishness we're doing.
What was that?
No, I said when we really break down what we're doing, it's kind of foolish when you really break it down, you know? It don't add up.
Yeah.
Yeah, it don't add up.
Yeah, so elaborate on that a little bit.
It's just like what you were saying, man, like the amount of effort we put in for certain things and like what are we putting in the effort for? Is it for the thing? Is it the perception of the thing or what the thing represents? It's not necessarily for the thing. Because if you need a place to stay, right? Think about like living a lot and how the living standards has like changed from what I grew up to what it's now. Like what's the expectation of how you should live and where you should live and how it got to that point, and how expensive it is to do that and what's needed to do it. And what's the risk reward? And why can't you just chill at another place?
Yeah.
So is it the place or is it the type of place you're supposed to be in?
Yeah.
Is it the item? Is it the necessity of the item or the prestige that comes with the item?
Yeah. That's exactly why they're miserable in the States, man, is because the States, it's a goal to obtain things. How much things can I obtain and conquer? And over here I just came back from Uganda, working in the villages, doing mission work. I just over 750 people in that week, man. Just adjusting. I mean, I have videos. Maybe you can throw them on somewhere we can show it. But I mean, like one after another, they're laying down to get adjusted. And all of them are so happy. And they're
Appreciative too. Appreciative.
Yes. Very appreciative, man.
Appreciation.
Absolutely. And what I noticed is that the food quality, I feel like the food is contaminating the minds of the people too, making them miserable in the States because it's all GMO, all modified, all made for capital gain. Where in Uganda, I said, oh, you know, I'm hungry. They said, oh yeah, no problem. They go into the backyard, everything is cooked fresh, like off the tree. I got that. Oh, rice, they grow the rice in their backyard, you know, and so they just say, oh, just one moment. You go to the restaurant, you know, and for a moment, I was American as hell. You know, I got to the restaurant. I'm over here like, man, this customer service sucks. They taking one order at a time. I'm like, man, but they're making everything fresh.
Facts.
So it's like I had to,
Back.
yes, like, whoa, okay, yeah. And I can appreciate the food more because it's like, man, this is all like, there's no fridge. They don't save nothing. You know, whatever you eat it's gone, you know? So this is that culture. It's so much more healthier, so more rich that you're actually stronger, you're healthier, your mind can process better, you're more alert, you're more aware, you're quicker, than the food that's you eat now in the States. It's heavy on the body. It takes time to digest and break down the stuff. You're slower, you're not as primal than these people. I mean, Uganda is like maybe it's one generation away from pretty much being like primal. You know what I mean? Like it's as primal as you can get because they grow all their own food. You know what I mean? They lived in the bushes, so they know all the natural instincts to be able to like this is the most primal, and so that's why they're the most optimal. And whenever you look at the like African culture in a whole, they're just stronger, faster, more developed, all these different things, because in America they're known for being lazy. Like, oh, I need something built, I'm gonna go call somebody from Mexico to come and build it. Okay, oh, I need some clothes, man, I'm gonna call somebody from China to come and build it, come make my clothes. In Uganda, they built their house from scratch themselves. They built their own house. Everybody builds their own house. So the skill traits, all of that that was so opening to me. Was like, man, I'm so far behind. Cause I'm thinking like, oh, I'm a doctor over here. I'm the honcho. No, sir, you're actually not anything at all. You can't even build a house. So you're like, it really, I'm so grateful for that opportunity, because now it helped me look at what's really important. Like you said, what is really important? Is it this, oh yeah, I got the Lambo and all this stuff in the States, but you can't properly defend yourself or grow food for your family that's naturally organic. Like I went home and I planted like my own avocado tree, blackberry tree. Like it's way different in Uganda because their soil's rich. It's a tropical place, so like you can just drop a seed and forget about it, it'll grow. Over here in the state, you have to literally make a whole little small patch of an environment that would make that plant grow. So, but I challenge myself with that, to be more, aware of that, learn more of like agricultural, because I already work with my hands, and that's one thing that's also important on like if you do have chronic issues with your occiput being out of position. What we do is not only do we stabilize it and we work on the posterior chain, but then we also encourage you to pick up something with your hands, because then that also increases the right side of your brain stimulation, which is joy and everything. So pick up painting, piano, playing a guitar, molding, because when you use your hands, it's a direct correlation to joy. So, that's why I'm, when I came back from Uganda, it was like a straight shift on, man, I was over here pouring into this community, but they were actually pouring so much more into me, because I was able to be in that environment and be able to just learn, and the body's adaptive, the mind is adaptive. So whenever I'm just sitting in that environment, waking up and going to sleep when there's no AC, once again, it's adapting and refining the body and micro tuning it to be able to withstand that information, but also grow in that area too. So coming back to the States, it's like not to fall back into some of those patterns, diet, different things where you're just lazy. And how do you activate more parts of your brain by using your hands, being more agile, growing something? That's a sacred thing right there. To be able to like grow something, and then after you grow it, you eat from that, you harvest from that. It's a ceremonial, sacred thing right there that many people will never even know in the States. They'll never be able to experience that, because, oh no, I'm just gonna go to Sprouts right here and get this thing that's contaminated with all this pesticide spray and everything. I mean, literally, you get a grape, you have to spend so much time wiping the grape off from all that paste they put on there to preserve the fruit. And so, now I have this blackberry vine that I'm growing in the backyard, and it just grew its first little blackberry, and it's just the craziest thing. Looking, I'm like, man, that is so crazy, because this is all like organic. I prayed over this while I planted it, prayed over every day while it was growing, so it was like so cool to see like that little blackberry come out, and then in time I can just harvest that and eat that, and I know that that's all from a ceremonial, like I know everything about that blackberry, right? Then like you get it from the store, and it's like, where did it come on a shipment, truck? Was it hot then cold? Well, you don't really know all that was into it. So being in these places, especially after natural disasters, and seeing that when I touched down there, the joy of these people, the appreciation, it like weighed on my heart, and actually like opened my heart way more, where I'm able to sacrifice more and release attachments more. That's one thing that I really sit with a lot, is that the universe, God, the innate intelligence, it doesn't have any bad will towards you. It's not trying to harm you and make your life worse, but it doesn't have any goodwill towards you either. It's just present. So how do you have no attachments to the outcome? Because sometimes life is just lifing, right? But sometimes it's just awesome. You're just like, man, what? Like, this is so good to be true. You just get the raise, you get this, you get that. Everything's just doing great. Body feels good. But you can't have any attachments to that either. You just have to be in that they call it like a low positive, where like you're very optimistic and you want good things in your life, but you're not
okay with the other part, bro. You gotta be okay with the other part.
Absolutely.
I think that as I make sure I learn more, is that I think this is for progressive people. This don't apply to everyone, so they probably can't relate, right? But when you're envisioning certain stuff, you do have a certain outcome you're looking for, right? Because it's like you don't even want to acknowledge the other part.
Mm-hmm.
And you're not acknowledging the other part to be a pessimist, but you acknowledge the other part to say, hey, you know what? I'm aware that this is one of the possible outcomes, and I'm okay with it.
Mm-hmm.
I'm still putting the effort for this.
Yes.
So if this happens, I'm okay with it.
Yeah, absolutely. Yeah. No attachments, because whenever I was first getting into chiropractic too, I was naturally pretty good at adjusting. Just naturally, I had that gift, which is just so crazy how I even got into chiropractic. I had reflections about it. Like before I came here, I was just thinking, I'm like, man, literally because of that guy and subconsciously my mom having those back issues, it's just aligned for me to be here, because I never thought, yeah, literally, they're aligned for me to be here, where I'm like, I'm sitting here and I'm just like, man, I'm actually, like laying hands on people and getting them well. And it's it's close to like the Bible is biblical almost. Like Jesus would go and he would touch these people and they'll get better. Touch healer, it's just that same kind of concept there. And, I was naturally gifted with adjusting, and I remember I would adjust these people and they would have all this praise for me. When I first was doing some good work, I was helping this one dude who couldn't walk, woke up, blew out a disc. Literally, parents called me. We had to lift him out of the bed to put him on my chiropractic table. Adjusted him, and he was walking after that. And he was like, he literally called me a god. He's like, you are God. And like, just the energy of somebody pouring all of that praise onto you, it works on your ego. Like it just massages your ego where you're like, oh yeah, yeah, exactly, But then you have people where you adjust them and they come back and like, man, doc, I couldn't sleep after that. This thing hurts, And so then it just like brings you all the way down. Like, yo, like, am I really good, or was it like a fluke, or And so how do you not have any attachments to that? Because that happens too, right? And doesn't mean that you didn't do good work. That's just the process of it, though. That's their healing process. Like they get the adjustment, and at first it's a little rough on them, but over their 6 weeks of you treating them, they get the healing they need. Some people, you hit that adjustment, it's like a miracle. Nothing hurts anymore. Okay, well, each one is such a dynamic thing on the spectrum that if you attach to any of them, you can go into complete depression. You can go into a whole ego war. So how do you balance out, not only in just, I learned from chiropractic, but I apply that to everything in my life, where like if I obtain something that's nice, or I get an award or accolade, it's almost, people think I'm nonchalant, or monotone, but it's because I've mastered, I wouldn't even say mastered, but I've gotten really good at having like a low positive where like I am appreciative, but I'm not too attached to that thing where I'm like, now I'm this person that is known for this, so that's why I'm trying every day in my life, is because I go to Uganda, and I teach all around the world, different chiropractors, people who are like 60 years old, and I was like 26, showing them how to do certain things when they've lived more life than me, and just the dynamic of everything I'm doing. I had to learn that very quickly in order to maintain my like balance and my serenity in the spirit, but then also with engagements and relationships. You can't be too far hot, you can't be too far cold. How do you find that sacred median where you can still be present, so that the resonance of what you're doing and what you have to do for the world, people can heal in that? If you walk in and you have your chi in balance, I do a lot of qigong every day. Like, when I first touch down here, that's the first thing I do is I make sure that I move the chi in this area, so then now I have some type of balance walking in. That alone can help people heal without you even laying your hands on them. You just being in the presence and having the conversation, you opening, creating the vulnerability, creating the chemistry in their brain to change without you physically doing an adjustment. People can start to feel better and start to heal. And I had patients that come in and they do all the intake paperwork, and it says that they have chronic migraines that are debilitating and they haven't been able to sleep. They also get nauseous, and then sometimes they pass out. And they come in and I do a closed door policy similar to this. Like, they walk into the room with me, I close the door, and then everybody else that needs to go next to in the lobby like this, and it just open door, closed door. I close the door because it stores the chi and that energy that it just stores in the room. Each person I just keeps building the chi in that room. And so there's times when people walk in and I read the paperwork and I'm like, okay, see, they got migraines. So I'm like, okay, tell me a little bit more of what's going on. They're like, well, sometimes whenever they try to find it, and it's not even the thing that they usually get isn't there anymore. From them just coming into that chi, that healing energy, that I didn't even have to adjust them, and some of the things is already is clearing up. And so that also taught me a lot too, where it's like, okay, if I'm not too far on the spectrum of, oh, you're awesome God, and oh man, you really don't know what you're doing at all, then in that space right there, like, God does crazy miracle things through you. Yeah, through you just being present. He just works through you. Things just start happening, and you can't explain it. Science can't explain it. They can't even explain what's going on. And then that's how your clinic gets busy, and it took me like a year of practicing, and then I became the busiest chiropractor in my city. And there's like 23, 24 chiropractors in there. And it was from these practices that I developed and me just being like very just present and aware. And it's all been referral. I'm glad that I bumped to you about this marketing thing, because I think God's working in a way too where it's more divinely, where he's creating like a certain relationship that aligns for something like that. Because I've been presented with different opportunities, but it just never really like made sense. I wasn't really feeling it, and I'm doing fine without it. So then I'm just like, why do I want to spend money when I can keep more money for myself, when nothing's like no harm, so but yeah.